Hello everyone, I'm Dr. Sheetal. I'm an aesthetic and anti-aging physician and I run my clinic by the name of Define Aesthetics in Pune, India. Today I would like to talk about importance of hormonal balance in anti-aging medicine and like to share findings of studies based on a novel technology based on analog waveform. Aging is physiological and it leads to a lot of changes in our body, like memory loss, hearing loss, vision problems, high blood pressure, decrease in stamina, skin changes, etc. But there are some changes which occur with aging which are metabolically important. There is decline in metabolic hormones with aging, which leads to reduced resting metabolic rate and also reduced basal metabolic rate. If accompanied by a sedentary lifestyle, this can lead to tremendous amount of weight gain, which ultimately causes systemic inflammation. Sedentary lifestyle has a lot of adverse effects on our body. It causes systemic inflammation, increases adipose tissue accumulation, increases toxins accumulation, oxidative damage is increased, there is hormonal imbalance, it lowers immunity, it can lead to chronic pains, and all of this predispose us to obesity. Now, importance of exercise cannot be overstated. Physical activity has been proposed as a primary prevention against many chronic conditions like metabolic syndrome, obesity, insulin resistance, type 2 diabetes, non-alcoholic fatty liver disease, coronary heart disease, hypertension, and even premature aging. But is there any downside to exercise? Well, exercise is perceived by our body as a form of stress and it increases secretion of cortisol. This has been proven by many studies across the globe. Now, cortisol is the same hormone which invokes the fight or flight response as a response to stress in our body. Now, cortisol to some extent has its advantages because it prepares our body to deal with stress. But very high cortisol levels, especially over prolonged duration, can lead to a lot of adverse effects. Some of the important ones are it increases insulin resistance, which predisposes us to type 2 diabetes. It decreases amino acid uptake by muscles, thereby preventing the muscle strengthening or muscle gains. It increases abdominal fat deposition, thereby increasing the central obesity. It can increase osteoporosis and reduce osteogenesis. These effects can potentially counter the weight loss benefits which come with exercise. Now, cortisol and testosterone have an inverse relationship with each other. Many studies have observed that as cortisol levels increase in the body, the testosterone levels start to go down. This leads to hormonal imbalance, and the low testosterone levels can be an additional problem contributing to weight gain or inability to lose weight despite of physical exercise. Now, what can be the solution to all of this? So we studied effects of a novel technology based on Pollock's London University invention. This technology can serve as both additional or an alternative to physical exercise. It can be an alternative solution to those who cannot exercise due to neurological conditions or certain medical conditions or simply because of excess age. Various studies on this technology have reported significant reduction of visceral fat on MRI scans, significant muscle mass increase, increased concentration of T3, testosterone and DHEA, unchanged cortisol levels, and no lactic acidosis. So essentially, this technology can be used as an addition or an alternative to exercise with all the benefits of exercise and none of the side effects. Now, this technology synthesizes and regulates complex analog waveforms which replicate the exercise physiology. Subjects experience this as either fast-paced or slow-paced physical training, depending on the settings used. Device has two waveform control norms corresponding to a total of 24 square waveforms. Each waveform is synthesized by 4,000 sine waveforms having a specific resultant frequency, which ranges from 55 Hz to 888 Hz. The device generates muscular contractions, each sustained for 8 seconds with a 2 seconds rest time. There are no known side effects of this technology, and the only contraindication being a cardiac pacemaker. I would like to share with you results of 2 studies based on this technology. The first study was done on 8 subjects, 4 males and 4 females, ages from 27 to 45 years. And the subjects received 6 effortless exercise treatments, each lasting 45 minutes, twice a week for a total of 3 weeks. The measuring instruments included a conductance scale, which calculated BMI, weight, overall fat, visceral fat, and skeletal muscle mass. Tape measurements of upper abdomen, umbilicus, and lower abdomen. Blood tests for lipid profile, thyroid profile, HDL, DHEA, testosterone, and cortisol. The findings of this study are as follows. There was significant reduction in visceral fat. There was significant reduction in total body fat, which also reflected in centimeter loss. There was significant increase in the muscle loss. Even overall weight loss in terms of kilograms was observed. There was statistically significant decrease in very low density lipoprotein and also decrease in triglyceride levels. There were no changes in cortisol or testosterone, and there was increase in the free T3 levels. Another study was done on 50 patients, 24 males and 26 female patients, age ranging from 84 to 70 years, and the BMI ranging from 20.3 to 43.3. Exclusion criteria for this study were pregnancy, implanted device like a cardiac pacemaker, severe hypothyroidism or any other uncontrolled endocrine condition, severe hypotension, hepatic cirrhosis, renal failure, surgery or childbirth within 3 months, cancer, hernia, any other severe medical or mental condition. Subjects were divided into 3 groups, which received 10, 15, and 20 treatments respectively. Each treatment was of 45 minutes and the treatments were given twice in a week. Subjects were advised to take a healthy diet with adequate protein, lower the intake of sugar, and avoid the intake of alcohol. They were also advised to exercise 40 to 45 minutes per day during the treatment period. 3 readings of abdominal girth were taken, 2 centimeters above the level of umbilicus, at umbilicus, and 2 centimeters below the level of umbilicus. The findings were as below. The group with 10 treatments showed minimum reduction in abdominal girth of 13 centimeters, a maximum reduction of 43 centimeters, with an average of 24. 15 treatment group showed minimum reduction in abdominal girth of 16 centimeters, maximum 55 centimeters, with an average of 33. And the group with 20 treatment showed minimum reduction of 16 centimeters, maximum of 65 centimeters, with an average reduction of 41 centimeters. So this reduction in abdominal girth can be correlated with reduction in visceral fat and central adiposity. All the patients reported improved stamina and endurance, similar to an effect of a consistent moderate exercise. There were 3 patients with diabetic mellitus. They reported improved sugar control, reduced dosage of medication at the end of the study. 1 patient reported conversion from insulin to oral anti-diabetic medications. There were 4 patients with deranged lipid profile who showed improvement in the lipid profile. 1 patient showed documented reversal of fatty liver on ultrasonography. I have been using this technology since last 10 years in my clinic, and here are some of my patients before and after findings. This is a patient showing result of significant reduction of abdominal adiposity after 20 treatments. Also, skin laxity is improved, as you can observe over here. This is a patient with mainly visceral fat deposition, and this is his result after 15 treatment. He shows significant reduction of visceral fat. This is a result of another male patient with 15 treatments. This is a female patient, the result of 10 treatments. And this is another male patient after 15 treatments. You can again here observe the reduction of the visceral fat. So thank you so much. That's the end of my presentation, and thanks a lot for giving me the time.